Institute of Bioenergetic Medicine, Imeb, is privileged to present a bioenergetic method that has proved its therapeutic value over the last 15 years. Using important scientific results from around the world, we integrated the benefits of the ion magnetic inductor, PAPIMI, bioelectrodiagnosis, therapeutic laser, photosonic therapy, and biofeedback.
I feel better than before I came to the clinic.
Since the first treatment, I felt a great relief from pain.
Before I started this treatment, I took a lot of painkillers.
When I got here, I was very sick, and now I feel great.
Imeb's goal is extending life expectancy while improving the quality of life of our patients, restoring their bioenergetic balance. Imeb and BA Global Health's goals are to merge our companies and expand Imeb's methods and breakthrough protocols to patients worldwide.
My daughter received the PAPIMI treatment. We immediately saw improvements in her condition. The doctor made the diagnosis and we started the PAPIMI treatment. My pain began to diminish and I started feeling better and better. Now I don't feel any pain.
The benefit of the PAPIMI machine, which I think God was invented, it relaxed me in such a way. You should try it.
PAPIMI is a new electrotherapeutic system developed by Dr. Panos Papas of Athens, Greece. His system produces magnetic pulses of great amplitude and short duration. The present PAPIMI system is an ultra-fast, short duration, and a thermic bipolar magnetic and induced electrical pulse generator. The Dr. Papas hypothesis states, the more the electromagnetic pulses are instantaneously higher, of shorter duration, and less overall power, then the more activation of the internal degrees of freedom of molecules occurs. These are factors of biosynthesis. The less the dissipated heat produced, the greater the biological beneficial results. The BED system finds the organs with bioelectric dysfunction. It shows the points that need treatment and the times of treatment application. It also provides the graphics that allow us to follow the evolution of patients. BED allows us to follow the treatment evolution using graphics. These graphics help the doctors to evaluate the treatment and make a comparative study of the patients.
In the 10 days that I've been here, I've seen a lot of improvement. Before, to look to the side, I had great difficulty turning my neck. Now, I can move my neck. It's not stiff and painful like before. Thanks to PAPIMI and the doctor, I'm feeling a lot better.
Imeb also uses the low-level laser therapy, where the coherent and monochromatic light of the laser is used as an analgesic, inflammatory reliever, and local circulation promoter. Imeb developed a unique method of treatment merging laser therapy, photosonic therapy, and pulsating magnetic field therapy. This method proved to be very effective and economical in time and expense for treatment of local traumas, systemic disorders, and diseases.
That night I was able to sleep. My arm didn't hurt and I didn't need to take any pain medication. The swelling in my fingers began to disappear in the course of the treatment. I feel very satisfied with this treatment. It's been 10 weeks. For me, PAPIMI, detoxification, and the bioelectric magnetic diagnosis and the treatments I have received have been a blessing. It has allowed me to have a better quality of life, which I hope will continue.
The biofeedback technology used in Imeb correlates the bioresponse data and the emotional energetic states of our patient. The biofeedback system that Imeb has integrated to its diagnosis method reads the galvanic response and temperature of the skin, then analyzes this data and then projects color-coded images on a video monitor which represents the patient's electromagnetic field, mental, emotional, and physical energy levels. We use the bioelectrodiagnostic and the biofeedback as diagnostic techniques. These skills allow us a more accurate diagnosis even though the patient may be asymptomatic. If we combine PAPIMI with low-level laser therapy and metabolic treatment, we can obtain better results in a shorter time. The ideal protocol is to combine the diagnostic and the treatment techniques. This allows us to attack all the patient's health problems and follow the recovering evolution.
I sleep better now. I no longer take antidepressants. I fall asleep easily, I get good rest, and when I wake up, I'm not tired.
El efecto es completamente rápido.
You feel the effect very quickly. You don't have to wait. From the moment I receive the treatment, I feel better.
Entonces ya me empiezo a sentir bien.
Through a combination of the therapies we provide at Imeb, we have had great amounts of success in the following medical areas: hypertension, heart attack, arrhythmia, high cholesterol, adrenal insufficiency, pancreatic insufficiency, estrogen deficit, testosterone deficit, stomach ache, sores, gastritis, indigestion, abdominal distension, ovarian cysts, infertility, hormone deficit, vaginal infections, HPV virus, Alzheimer's, epilepsy, Parkinson's, migraines, headache syndrome, cataracts, retinopathy, attention deficit disorder, respiratory syndrome, malnutrition, all cases of inflammatory condition, tendinitis, musculoskeletal pains, sprains, sports injuries, fractures, back pain, joint pain, neck pain, cervical pain, osteosporosis, arthritis, diabetes, fibromyalgia, chronic fatigue, stress, depression, insomnia, anxiety, asthma, sinus problems, emphysema, bronchitis, fibrosis, allergies, immune suppression, cystic kidney disease, urinary incontinence, urinary tract infections, and kidney stones.
I could sleep the most 4 hours, and after my first treatment, I could go to sleep without waking up during the whole 9 hours that I slept.
A partir de la segunda o tercera sesión fue cuando
From the second or third session, that was when I noticed. I realized that when I spoke to her, ear to ear, but without the hearing aid, that she responded to me. I started crying, and she asked me why I was crying. I told her, it was because you could hear me. You answered me.
me contestaste.